So I have noticed a surge of Canadian YouTube subscribers, quick facts going to Canada, just a lot of emails from people in Canada. And the reason is because in January 2015, Canadian nurses will have to take our NCLEX-RN exam. Now, this is really cool because it's been a process that has been going on for the last 3 years. In 2012, it was established that the NCLEX-RN is such a wonderful exam that it will be required for all of the provinces that are listed in the video to take it now. So what does that mean for Canadian nurses? Well, that means that you guys have to really prepare yourselves for the beast that is NCLEX. We've been taking it for a long time, and we know the terminology, we know the language of the questions, how they can be confusing, what you need to know. This is all new to you guys. This is totally new. So if you are watching this video trying to get more information about it, let me just tell you. When NCLEX is coming up with test question material, what they do is they send out surveys. Now, they have done this in Canada as well, but over 2,000 nurses received a survey, and on this survey were 149 different skills that first-time nurses may encounter. What NCLEX was looking for was how often new nurses in Canada do trach care, how often do they discharge patients, how often do they transfer patients, how often do they work with arterial lines or things like that. And NCLEX, from that information, has come up with exam questions. These are the kind of things that you're going to expect on your exam. So it's going to be a pretty fair exam. They have combined the survey results from U.S. nurses and Canada nurses, and they made a combination of the answers to make this exam. I did read that some French nurses, or Canadian nurses who spoke French, are being consulted to make sure that if the test is offered in French, it has the same translation as in English, like to the T. So I think that will be a benefit for Canadian nurses who speak French, that they will have the opportunity to take the exam in French. The cost of the exam will be 360 Canadian dollars. It still has the same passing measurement as our U.S. exam, which is 0.0 logits. In Canada, you only have the ability to take it 3 times in order for you to be successfully considered a registered nurse by the NCLEX standards. And if you pass it in Canada, you will be able to come to the United States and work just like anybody else. So I look forward to helping you study for NCLEX. The push is for nursing schools to really get their act together, because previously the NCLEX was not something that the nursing schools in Canada had to worry about, but I will definitely expect them to completely change around their program in order to make sure that their students are able to pass this exam. So you guys who are nurses already in Canada and trying to take this exam, it would behoove you to get yourself an NCLEX review course to make sure that you understand the concepts that will be tested on it, the strategies that you potentially could use while testing, and also how to make sense of it all and make your life less stressful when it comes to taking this NCLEX. All right, thanks for watching this video. Bye-bye.